Well, this month is Breast Cancer Awareness Month, and you know, or someone who has gotten that diagnosis. It's not easy, and having support is so important. ProMedica Dr. Jessica Burns is a breast surgeon at ProMedica and is with us today. Doctor, thanks for being here.
Thank you for having me.
Yeah, so first of all, what does that mean, your specialty?
So I'm a breast cancer surgeon, so typically my office is the first stop for patients who have received a breast cancer diagnosis. So we sort of take the lead in explaining their diagnosis to them, discussing their pathology reports, discussing treatment options, and then making sure that they are moved along to the other providers who need to see them.
Gotcha. So you do things like lumpectomies and mastectomies and things like that?
Yes.
And make sure that they're on the best course in their treatment journey. So it is October, so we are wearing pink. You're wearing pink today. And to raise awareness for that, because as I said, either you or someone you know, like we're all touched by it, unfortunately. It's so what are some things that people should know about breast cancer and what we should maybe all be doing in our daily lives?
Excellent question. So breast cancer is an increasingly common diagnosis. So about 1 in 8 women in the United States will have a diagnosis of breast cancer at some point in their lifetime. And it's important to remember that men can be diagnosed with breast cancer as well. So early detection is really the key to cure. So we focus on educating people about risk factors, signs and symptoms that they need to watch out for in terms of what may indicate a problem or a breast cancer diagnosis. And also we really stress the importance of screening mammogram, because mammogram is extremely important for early detection.
Yeah, and I think it's just always following up even with your primary care, you know, and just being on top of it, and that way that early detection, as you said, is the key. You know, that first thing your doctor might notice, or maybe it's, I have a question, I'm not really sure about this, and that person, that doctor can lead you, you know, where you need to go. So in terms of those screenings, though, mammograms, are we still saying about 40 years old for that? Or? Yeah,
we say for women who are at average risk of developing breast cancer, 40 and annually is when they should be receiving their mammograms. So 40 and every year. For patients who are felt to be at higher risk of developing breast cancer in their lifetime, then earlier screening may be appropriate, 35 or even younger potentially.
And you are seeing patients who are being diagnosed at those younger ages.
Yes, we are. We are seeing a decrease in the average age of patients at diagnosis. Absolutely.
So especially if you have that family history, that might be something to also point out to your PCP, you know, hey, my mom recently had this diagnosis, or, you know, somebody in my family. And those mammograms, they sound kind of scary, don't they? I mean, it is, you know, nobody wants
to have a mammogram.
But the thing is I've had like 4 or 5 now at this point, and it's you're in, you're out. The technicians are so wonderful working with you and they're making you feel as comfortable as possible, and, you know, getting you in that right angle and doing that, you know, just so they can get the clearest picture. But it's become a lot easier these days too to get scheduled, and I know ProMedica has kind of made that a little bit easier too.
Yeah, absolutely. So you can schedule your own mammogram online at your convenience. So really there's very little excuse for not having one done. No one wants to have one done, but it's so important.
Yeah, just get it done with. And if you are on the younger end, you know, get that baseline so that you know what to work with from there. You know, if you do get that diagnosis, I imagine it's so important to have, you know, that support. You know, you obviously probably have some family and you have some friends, but they may or may not know exactly what you're going through if they haven't had that diagnosis. So there's support groups available. I know there's one specifically in Monroe at the ProMedica Monroe Regional Hospital. That one, there's the information there on your screen for that, every 3rd Tuesday of the month at 6:45. So there's just one, but we talk a lot here about the Victory Center on WTOL 11. So that could be another place too.
Absolutely. We love the Victory Center. We think support is so extremely important. Patients do better when they are appropriately supported, both emotionally and with appropriate and adequate resources while they're going through their treatment. So support groups are very important. We're very lucky to have the Victory Center here right in our backyard that has a whole host of resources available for patients throughout their journey. Free, absolutely.
Free stuff. So I imagine when that diagnosis comes, that patient can just simply ask, you know, for those resources.
Yes. So in addition to Komen and American Cancer Society, the medical treatment team is really the go-to place for learning about resources for support.
Don't be afraid to ask.
Don't be afraid to ask.
It's tough, and you're taking in a whole lot at one time.
Yes.
So if you can get connected to those resources, that'll help with your progress and
definitely.
speedy recovery. Doctor, thank you so much for being here.
You're welcome. Thank you for having me. I appreciate it.